So in this lecture, we will discuss about the types of epidemics. So epidemics can be categorized as on the basis of common source epidemics, or on the basis of point source epidemics, or propagative or progressive epidemics. What are these three terms? Common source epidemic means all the individuals are exposed to common pathogen or noxious agent. So all of a sudden, so the common mode or common source is the mode of transmission is indirect. It can be through a vehicle borne, say like through the contact of this infected vomits, food, air, water, or any source. Even the secondary host to host transmission, it can be seen in that case. That is the direct source, that is person to person contact, is very rare in case with the common source epidemic. So common source epidemic, herein the direct source, the causative agent itself, its chances to infect that individual from one point or one source is comparatively far lesser chances. But the secondary host, that is suppose a water body, say from an water body that infection has started and it has spread to one particular society or few group of peoples in that particular society, or say the infected food, and then that infected food or that particular peoples, they have been responsible for transmitting this to the other geographical places, or say that infected fruits were transported to the market, and in market that fruits they have been in contact with the other fruits, so other normal foods or fruits they got infected, and that keeps on spreading. So here in common source epidemic, the secondary host is most important factor to spread that type of infection. By examining the epidemic curve, we can see that. So here is the curve. Here we can immediately see. So A is the minimum incubation period. Here is A is the first infectious agent who has caught infection. First host who has caught that infection. Here we can see there is no immediate rise in number of cases. The A has carried that infection along with him and pass on that infection to the another individuals. So this B individuals or B group of peoples, they have caught that infection and they have increased, the number of cases have significantly rised in that case. So for example, the infectious hepatitis A is transmitted by a food handler at a restaurant, or a water contaminated with Vibrio cholerae at a local lake or estuary. So through that, it has been transferred to the other sources, to other individuals, and from that other individuals, that following that incubation period, that has a sporadic rise in the number of cases. So what common source epidemic suggests is the secondary host here is responsible for that type of infection. The direct contact is rarely seen in that case. So by examining the epidemic curve, the fewest number of cases become apparent after minimum incubation period. The largest number of peak incubation period here we have seen, here is the time. So initially that incubation period was not completed and very few group of people were infected. But when a sufficient amount of time, that is incubation period, has been completed, that has sporadically increased, or there is a rise in the cases, number of cases. So largest number peak occur by the end of usual incubation period. So here we have seen here it has taken, so this scale is not complete. So we can consider, say it is 48 hours. So for the first 12 or 24 hours, there is no such spread of that disease. But after say 48 hours or 72 hours or 96 hours, there is sharp increase in the number of cases. The shape is typical unimodal shape of common source epidemic. Next is the point source epidemic. In point source epidemic, here we can see the graph and we can immediately distinguish now. The point source, the graph itself can explain all the things. So it says that the first or the primary exposure upon a sufficient time of incubation, it immediately gives rise to the number of cases. There is a sporadic rise in that cases and it keeps on immediately lower down. So this here we can see the bell-shaped curve. So all susceptible individuals are exposed to a specific pathogen at a particular time. So herein the pathogen, the host and time, three of these things they are involved simultaneously. Now the point source epidemic is a subcategory of common source epidemic in which common exposure to the offending pathogen or agent is both brief and simultaneous. Here we can see that time is for a very short span of time, where in case with the common source epidemic, here we have seen it has taken a long time. Even after that completing that incubation period, it has increased the number, and that there is no sharp decline in that number. Number of cases are declining but with a slow pace. This is not seen in case with the point source epidemic. In point source epidemic, there is immediate rise and there is immediate lowering the number of cases. Very explosive increase in the number of cases over a short period of time can be seen. Once incubation period has been attained, so the apex is much sharper and the decline in the number of cases is more rapid than a typical common source curve. In this case, the secondary transmission is rarely seen as it was seen in the common source epidemic. The example, after eating a dinner at a wedding reception, many of the guests developed the acute onset of gastroenteritis, that is food poisoning. So immediately after say 3 to 5 hours, and herein that the infected peoples are limited. Only the people who were part of that gathering, who has feed upon that food, they have caught with that food poisoning. And after 3 to 5 hours of incubation, they have shown their symptoms and they have not communicated or they have not spread that infection to any other individuals. So after a particular span, say 8 to 10 hours, that infection has been lowered down. Next is the propagative source epidemic. Now we are interested in this particular type of epidemic. Here is what happens in this propagative source epidemic. Serial transmission, as the pathogen is transmitted from one person to other. So it is contagious. Next is the mode of transmission may be direct. That can be direct human contact or direct aerosolized respiratory droplets. So through aerosols or through droplet, that infection can spread. So in propagative source of epidemic, the causative agent, the host, infected host, primary host, is directly responsible for spreading that disease. Or it may be even indirect with the help of some vectors. As we can see, there are some other parameters like environmental factors or the different types of vectors which can be seen in nature. All that can even help or they can augment, we can say, they can augment in spreading that particular type of disease. Now, individual immunogenicity and herd immunity, it plays important role in case with this propagative disease transmission. So here we can see this curve, and immediately after looking after this curve, we can guess, we can relate this particular to our present day COVID-19. Herein we have seen the first wave, then there is a secondary wave, then there is a third wave, this can be a fourth wave, and it can keep on increasing like anything. So immediately after third or fourth wave, the number of cases can lower down or it can even keep on increasing to any unlimited time period. So this curve, propagative source epidemic, they are of prime concern. The curve shows the initial rise in the number of cases that is less explosive than the normal point source epidemic. Herein, the number of cases they slowly keep on increasing. There is no such drastic increase as it was seen in case with the point source epidemic. Progressively or successive generations of secondary infection produces the polymodal distribution. Herein, such type of curve we call is a polymodal. So therein we will see wave-like structures. So even we call that waves, that is first wave of COVID-19, second wave, and likewise. So this polymodal distribution conforming to several generations of incubation period. So as the time keeps on increasing, there can be change in this curve. So here we can see this secondary wave, it has started and it has kept on increasing the number of cases to a new significance. So यहाँ पर number of cases बहुत बढ़ गया है. Then after a particular span of time, that number of cases has been reduced. Obviously herein there are the interventions carried out by the different agencies like World Health Organizations or CDCs or the public health departments and all. So likewise we have followed the some protocols, isolating ourselves, keeping 6 feet difference or distance amongst the individuals, or quarantining the infected persons and all. So after that, this number of cases has been reduced. But later on, after following this further incubation period, there is again steep increase in the number of cases. And as we all know, it has been predicted the third wave of COVID-19, there will be around 50 lakh cases or more than that even. So we can even guess this how or on the basis of what they can predict this. So what epidemiology is, we have to keep on learning all this data. We have to keep a watch on all these things. Based upon the past experiences, based upon the factual data and all, we can even predict what can happen. So on the basis of this particular type of curve has been given. Now in our syllabus we have they have included epidemic investigation. Now even after the outbreak of COVID-19, the CDC or the other apex agencies, they have started the investigations of this epidemic, or we can call it as a pandemic. So what is that investigation? Why to do that investigation? And what are the values of that investigations? So we'll study this in this particular lecture. Now, epidemic investigation is a set of procedures used to identify the cause, that is the infectious agent, which is the causal agent or which is responsible for that particular disease. Herein it is the coronavirus, the SARS-CoV-2, which is the causative agent of COVID-19. Now what are the values of this investigations? So its values is, it is also used to identify the people affected, so number of individuals they have been infected. Second, the circumstances, the mode of spread of that particular disease. So we all know that it is a respiratory disease and it can spread through air or through direct contact with the infected person or people. And the other relevant factors involved in propagating, means spreading this disease. Next is epidemic investigation is a challenging task for both the health workers, that is to investigate what is the starting point, where from the infection has started, how it is spreading, what type of interventions we can do or can be implemented to so as to stop or so as to lower down the infectivity rate. Next, the main purpose of epidemic investigation is to control the spread of this particular disease. So this is perhaps the most important thing that for which the epidemic investigation has been carried out. So we have to stop the spread of such kinds of diseases. We have to, based upon our earlier or factual data or earlier historical data, what we have to do is, in case there is such types of changing strategy as or changing cases or number of cases have been reported, based upon earlier observations we can immediately keep on some restrictions, or we can guide the CDCs or other agencies can guide to the health departments that these types of health measures should be immediately implemented. Likewise, in our Maharashtra, state government of Maharashtra, what they have done is they have witnessed the second wave of COVID-19, and based upon that and based upon the factual data, based upon the prediction given by Ministry of Health and all, AIMS and other scientists, so based upon that, the third wave is expected to come in couple of weeks. So because of that, the government has taken some preventive measures, and now there is conditions like lockdown has been imposed in the state of Maharashtra. So why to do this? So for that, investigations must be carried out. So epidemic investigations, its role is first of all to identify the causal agent, to identify the infected number of peoples, then provide measures to the healthcare workers, what things should be done or given, or what type of medication should be done. Then lastly, how to control that particular type of disease, that is isolation, quarantining, tracing, the contact tracing, and all these things has to be included. Next is steps of epidemic investigation, how to carry out this type of investigations. So first is verify the diagnosis or cause. So herein there is a careful analysis of the initial reports. So now we all know that this coronavirus is not the new virus, it is old virus, and there are different agencies who are keeping watch on all this number of influenza or such types of diseases. So there is increase in the number of cases across different countries or across the globe. So based upon that, they have given an alert that this type of infection or this type of what you can say pandemic can occur or epidemic can occur in this particular region or this particular area. Then how to identify that? So there must be some diagnostic methods. So we have to analyze the initial report, based upon that confirm the diagnosis by performing clinical and laboratory studies. Then putting the criteria for case definitions, that is how many number of individuals or what should be the case studies, which number of people should be included, what should be excluded, and all. Then establishing the existence of an epidemic, whether that particular incidence has taken place earlier, like we have past history of this influenza virus, we have SARS, we have MERS, so SARI and all. So based upon that past history, so we know that, or this group of people, they know that this particular type of infection can spread through this modes. So what precautionary measures should be implemented? That is wearing the face mask, avoiding the direct contact, keeping a safe distance, regularly washing your hands and all. So all these things are based upon our earlier studies. So what epidemiologist is doing, or epidemic investigation is carried out for base, it is based upon or comparing it with our earlier studies and the present new cases, whether we can relate it, and based upon that relation we can predict that further such types of incidents or further such types of diseases will outbreak or not. Next is describing of the epidemic as a regard in case of time, place, and person. So three things they have to be kept or must be considered. One is a time. Even in our dissertation also, what we are doing, we are learning about the COVID-19 in terms of time. So in this particular time span, say 1 month or 1 year, what has happened. Next is the place. We must define a particular place. If we are not restricting ourselves to a particular place, then it is very hard for us to come to a conclusion. And the third thing is a person. So we have to target our audience. We have to limit ourselves to a particular group of peoples. So it can be anything. It can be say 18 to 45 or 45 to 60, or we have to even define that group of people. Say it can be a people of a particular state or a particular country or particular culture or community. So while investigating, we have to keep in mind that we have to consider the time, place, and person. So three things are very important while investigating such types of cases. So by plotting the cases by time of onset, that is epidemic curve, we can draw. By plotting the cases by location, so we can draw a spot map. So likewise, if you go with the COVID-19, there is a dynamic graph available on government sites, wherein you can find this spot map, that is number of cases, kahan par kitne cases hai, you can immediately see that. Immediately by clicking that dot, you can get the data. Next is collect the data on the basis of the age, sex, etc. So herein we can limit ourselves, or on the basis of that we can predict that this particular type of infection can cause infection to this group of people, and this particular group of people, they are safe, or they can be considered as a comorbid, as it was stated that the person with 65 or 45 and plus, but with cardiac and other respiratory ailment, they are more prone to this particular type of diseases. So for this, there must be some past studies that must be carried out. So that investigations has to be carried out, and we here in our dissertation we are trying to carry out this in relation to our COVID-19. Next, after doing all these things, what is the further investigation step? So we have to develop an hypothesis to explain the occurrence of that epidemic. So what that hypothesis is? That hypothesis is based upon the time, place, person, the existence of that particular disease, the past data, and the causative agent, how it causes or what it leads to. Next is, after proposing or developing an hypothesis, say we have developed an hypothesis. So what can be a hypothesis? Say for example, we have studied the data of a particular hospital. In that case, we have included one hospital which was undergoing or which was carrying out the treatment of COVID-19 patients. So we have carried out a survey in which we have included, say, 100 peoples. Out of that 100 peoples, say 50 were infected with COVID-19. Amongst that 50 individuals, say 25 individuals were 60 plus. And out of that 25, remaining 25, say there were some people's between the age group, say 20 to 30. And some were, or very few peoples were of less than age group 10 or 15. Then we have carried out some questionnaires. We have collected the data from them. We have even included some healthy individuals who may have visited that hospital for what you can say, for diagnosis or for getting checked with whether they have caught with that infection or not. So say for example, we have taken a data of 100 infected person and 100 non-infected person. So based upon the available data, based upon the questionnaires and all that, we have proposed an hypothesis. What that hypothesis can be, it can be anything. Say out of 200 people, 50 or 50% peoples were infected. Next, we can say that this particular disease, it can spread through person to person contact. So this is second hypothesis. So what much distance should be maintained between this individual? So they have proposed that 3 meters. Later on they have increased or extended it to 2 meters. So they have said it 6 feet distance must be maintained between the infected person and the healthy person. So based upon hypothesis, they have subjected it to the field or they have trialed and they have tested it. After testing, we have to augment that hypothesis, whether it is whatever assumption that we have given in hypothesis, are they right or wrong? Herein we can improvise our hypothesis. Say for example, initially it was predicted that 3 feet or 1 meter distance is sufficient. But later on it was known that that infection that can spread through droplet or it can even spread through aerosol. So that distance must be increased. So that is how a hypothesis is proposed and later on it is tested. And for testing it, we have to go for different types of analysis. So for that, we can apply statistical analysis tools. So we can carry out different types of questionnaires. We can interact with the different peoples and all. And based on that, we can test our hypothesis. Next is identification of the susceptible population. After identifying that particular population, next thing is the management of that epidemic or management of that particular disease. Lastly, formulation of a report. That is, after carrying out this study, we have found that this number of peoples are more likely to get infected. This number of peoples are they can be escaped or they are having very low chances of infection. Then say for example, we are talking of say vaccination. So this much group of people, they cannot be included as of now, or for that this many things has to be done. That is the dose, say the particular dose of a particular drug, how much volume should be given, at what interval must be given. So based upon hypothesis, it has been tested, and that we have confirmed, and later on we have reported it and communicated these findings and given to a higher authority. That is, higher authority means here is the healthcare system, means the policy makers. So we have communicated, or the group of people or scientific people, they have communicated their findings to this CDCs and other agencies. Then they have given the guidelines and they have published it. Next is communicating it to the people, that is mass campaigning and publicizing that instructions. So likewise you can see this, all these things they are carried out through different agencies. Like say you switch on your TVs or your radios, there are common instructions, that is, there is a COVID-19 outbreak in the entire world, and what precautionary measures we must carry it out, and all these things. So this is what it is based upon the earlier findings. Then we have said, we have carried out the investigations, we have proposed hypothesis, we have tested that hypothesis, we have proved that, and later on we have come up to a particular report, and that report or that findings have been communicated to the apex agencies, and now they are circulating it to the layman or other group of peoples. So for what or how this investigation is carried out, we have studied here. Now, there are different levels of preventions. So it can be a primordial in preventions, that is, it targets the social and economic policies affecting the health. So primordial are the common or general types of guidelines. Say like, it is advised that whenever you go to your house or you enter your house, before that you must wash your hands and you must take a bath, or you must remove out your shoes and all outside. So these are some primordial preventions. So these are normal things so as to prevent the other or general types of infection. Here we can see this under primordial in preventions. There is a prevention of emergence or development of risk factors. So what type of prevention we can do is we can cover ourselves. Otherwise also, it is advised that we should wear a hanky, or we should carry a hanky with us. We must cover our face and nose while coughing and sneezing. So these are common etiquettes or normal things that are been issued, or we all know that we must follow that, so as to prevent the infection from the risk factor, and discouraging the harmful lifestyle, encouraging and promoting healthy eating habits, that is preventing obesity in childs and all. So herein there is no such direct specific focus to a particular disease, but in general, so as to avoid the infection of any type of causative agent. So this type of infections or this type of preventions can be considered in primordial prevention. Then primary prevention, it identified targets its risk factor leading to a particular type of disease or injury. Say for example, it is a COVID-19. So this wearing a face mask, washing your hands and all, these are the we can consider them as a primary preventive measures. Secondary preventive measures, they includes, they prevents the particular disease or that injury upon one's exposure to that risk factor. Say for example, you have been caught with an COVID-19. So what next you have to do is, so you have to isolate yourself, you have to quarantine yourself for 15 days, you have to avoid the public contact, and you have to throughout that quarantine period, it is advised you should wear a mask, the thing you touch, it should be sanitized and all. So these are the secondary preventions. And the tertiary preventions, as it says, it is rehabilitating the persons with injury or disease to reduce the complication, that is isolating, quarantining and doing other things which are at a next level, higher levels. So primordial prevention we have seen. Then primary prevention, it says action taken prior to the onset of the disease. It includes the conditions like immunizations, so vaccinations and all these things we can do. Chemoprophylaxis, that is protecting the peoples, so we are asking them to wear that mask and all. The healthcare workers, they are advised to wear the PPE. Then avoidance of allergens, so we should avoid the direct contact of that causative agents. Secondary preventions, that is disease control, halt the progress of disease by implementing in phases. Likewise, the what you can say, the lockdown and all other measures are taken. Early diagnosis and adequate medical treatment. Suppose you have been diagnosed or you feel that symptoms of this particular COVID-19. You are having respiratory distress. So it is advised immediately you go to a physician, you carry out your RT-PCR or HRCT, and based upon that you can immediately start your treatment. Next is the disease control. In secondary prevention, there is a disease control that is aimed at reducing that infections. So identify the incidence of disease, identify the duration of the disease, and consequently the risk of transmission of the disease. Physical and physiological complications should be identified, and financial burdens to the community must be learned. And say now why the government is initiating the free vaccination. Why do you think they are carrying out this free vaccination? Because if you compare or if you go with the financial comparison, suppose thousands of people or crore of people they have got infection. Ultimately, they will have to go under the treatment, and that overall cost of the treatment will be far, far, far greater than that of the vaccination. Therefore, the government or any agency, they have suggested, they do keep on suggesting to this decision making agencies that this is the cost, that is if you carry out this type of preventive measures, the further financial loss can be minimized. Therefore, vaccination, free vaccinations and other things has been carried out by this government and other agencies. Next is the concept of control. So there can be different measures to control. It can be elimination. So now there are 4 different terminologies which you may regularly see or you may have heard it. Elimination. Elimination is reduction of cases transmission to a predetermined very low level or interruption of transmission. Say for example, say influenza virus infection. So across the year, there are this influenza cases recorded throughout the world, throughout the globe. But this number of cases are very less. So there is a threshold. So say for example, this threshold is say 1000 number of cases per country per month. They consider this is a threshold. And nowadays it is more than 10,000 or lakh or like that. So there is no elimination. If this number of cases has been reduced to less than 1000, then we can consider that there is an elimination of that particular disease or that infection. Next is the eradication. So elimination, we can see that examples, the measles, the polio, leprosy. So they can be considered they are eliminated. So they are eliminated from a particular geographical area, say from a particular country or a particular continent. So measles, polio, we can say it has been eliminated. Elimination doesn't mean that it is 100% removed. Mind you, we have considered here a threshold. If the number of cases are below that, we can consider that it has been eliminated. Next is the eradication. Eradication is termination of all transmission of infection by extermination of that infectious agent, that is directly spreading of that infection has been 100% cut off. And how we can do this? It is can be carried out by surveillance and contamination or contaminants. So we are following that measures how that infection can be stopped or that infection should not be spread to other individuals. So herein we can say it is all or none phenomenon. For example, in case with the smallpox, we can say it is eradicated from the society. Next is third is the monitoring. Monitoring is defined as the performance and analysis of a routine measure. So we are nowadays monitoring the COVID cases. So COVID-19 cases are monitored. So we are observing them. So monitoring means defined as the phenomenon, the performance and analysis of the routine measurement aimed at detecting changes in the environment or health status of a population. So we are monitoring that whether this COVID-19 is infecting this children's or not. So below 15 age or below 18 age or 18 to 45 or 45 to 60 or 60 plus. So we are monitoring, we are keeping a watch on that, and based on that we can give a hypothesis or we can predict that there is a change in this particular type of condition. So Say for example, influenza or such types of cases, they are more seen in case of winter or a spring season, or a particular rainy days. There are chances of water contamination, and there is high chances of infections of fecal contaminations like Vibrio cholera and other types of diseases. Next is surveillance. So it is defined as the continuous analysis. Herein we are carrying out the performance and analysis. Here is an analysis of that conditions. So it is like we are watching it like a CCTV. What it does is it keeps a watch on that particular area or particular location. Likewise, we are watching for a particular disease. We are watching it in a society or a particular geographical location. So surveillance is the continuous analysis of the factor that determine the occurrence and distribution of a disease and other conditions of ill health. Example, poliomyelitis. Its surveillance program is carried out by WHO, and in case you happen to find that this number of cases are increasing, immediately there is a quick action against that particular diseases. Next is the tertiary preventions. So what type of tertiary preventions can be done is the interventions in the late pathogenesis phase, that is reduces the impairment or minimizes the disability. Suppose the person has caught the infection. What next? So care must be taken that infection should be restricted to a particular organ. So it should not spread to the other organs, or it should not affect the major other organs. So like in case if the person has been immediately or earlier diagnosed and the treatment is started, the spread of infection can be lowered down, or it can be reduced. Then disability limitations. Suppose that infection has entered in the other organs, that it can lead to organ dysfunction. So that can be controlled or that can be limited. So tertiary prevention is limiting all those things. So disability limitations. The objective is to prevent or halt the transmission of disease processed by an impairment of that handicap. Sequences of events that leads to disability and handicaps are disease, that is impairment, that is do not allow it to spread to the other part or other location. We can call it as a disability to move or disability to cause infection, and in general we can say that we are handicapping that infection. Impairment is the loss of or abnormality of psychological, physiological or anatomical structure or function. And disability, any restriction or lack of ability to perform that particular act or activity. So it can be considered as a disability. So in a impairment to disability. So impairment means it has that thing but it is not now functioning. Disability has lost that function. Handicap, it is not having that part or that organ, because of that it is now called as an handicapped. Any disadvantage that prevent one from fulfilling his role as a considered as a normal. And rehabilitating has been defined as a combination and coordinated use of medical, social, educational, vocational measures for training and retraining that individual to the highest possible level of functional ability. That is, handicapped person can be rehabilitated. That is, the loss which was, what we can say, it is non-bearable, but it has been to some extent has been neutralized or it has been reduced. Now, area of concern in rehabilitation. So there are several different areas like medical rehabilitation, that is the treatments and all. Occupational rehabilitations. So you can consider the government of India, what type of rehabilitative measures they are doing. First is medical rehabilitation. So they are providing vaccinations, or they are providing the treatment protocols, SOPs and all. Second is occupational rehabilitations. So they are providing proper guidelines, what should be done, what should not be done. So even the financial rehabilitation can be done. Social rehabilitation, the peoples or the group of peoples, say for example the handicapped peoples or visually impaired peoples, they are not able to go for the vaccinations. So government, they are arranging special camps for them for undergoing vaccinations. Then psychological rehabilitations. So there are different types of helplines like Niemann's and all. They are working out for psychological counseling and all. The person who have undergone this particular COVID-19 or such types of infections, they have been given advised based upon their needs. So there can be different areas where in rehabilitation measures can be taken. Now, prevention of communicable diseases. So primary prevention, health promotion and specific protection. So communicable diseases which can spread through direct contact. So it can be best controlled by, or primarily preventions can be carried out by sanitary environment. So maintaining proper sanitation is the first and foremost thing. So health promotion and specific protection things has to be implemented. So sanitary environment, the environment would be free of vehicle of infection, that is the causative agent, polluted air, water, milk, food, or whatever source from which it can cause infection. Next is the vector of disease. So whether it is arthropod borne or say malaria or mosquito borne infections, so that vectors, their minimal numbers or that entry should be restricted. Then rodents, including rats, potential reservoir of many infectious diseases, they can be controlled. Likewise, the cockroaches and all. Infected animal reservoirs, stray dogs and cats, which can lead to different types of diseases, say like plague or rabies and all. Now, components of sanitary environment, it includes proper town, village or district planning and design, proper sanitary disposal of waste, good housing and suitable ventilation, food and milk sanitation, eradication or control of insects, rodents, stray dogs, etc. Now, health education of the people, they are also included in that case. So, make the awareness amongst the people. This is perhaps the most important thing that we can do. So, if the people are aware of that, what or how that infection spreads, so you can take necessary precaution. So, proper knowledge, attitude, and practice related to the health with special consideration of lifestyle can be publicized. Health promotion of the public. Health promotions can be achieved by fulfilling the requirements of health, physical, mental, social health, prenatal, natal, and postnatal care should generally we can see this. So generally, the women's in the remote area or rural areas, they or in the area where there is scarcity of food, so they may be not having proper nutrition. So this types of care can be provided. The nutritional sources, say like government of Maharashtra, or there are different government policies which do provide food for this expecting mothers. So prenatal, even after birth or during birth also, there is free vaccinations, there is a proper diet, or um, there is recommendations of different types of vaccinations. The folic acid and other treatment are given to those expecting mothers. And even after the post delivery, this child or the fetus, they have to go undergo vaccinations. That is, they have to follow the immunization schedule which is freely available in the government hospitals and all. So these are all the measures that government can do so as to avoid that type of infection. Now, specific preventions, those specific prevention, they are against specific type of diseases. So like a couple of years before, there was a mass vaccination of MMR amongst the children's below the age of 5. There was a mass vaccination and of MMR, measles and measles, mumps and rotavirus. Against them, this vaccination was carried out. So across all the schools of the country, this types of vaccination was extensively carried out. So this specific prevention is a specific protection of a man or a particular group of people against a particular causative agent. So by carrying out, even now we are taking this COVID-19 vaccinations. So they are targeted vaccination. And even chemoprophylaxis means protecting this group of people who are working in that area. So healthcare workers or the people who are working with those agents, is the proper care must be taken. So chemoprophylaxis is, it is administration of antimicrobial drugs for specific protection of certain infectious diseases, so as to prevent the development of those diseases, or so as to provide them as a carrier state. So generally, the healthcare workers, they may caught that infection from the patients. So generally, if they follow this protocol, they maintain their own hygiene, they can avoid the infection to the other peoples. So there are limitations of chemoprophylaxis, we all know that there's antimicrobial drugs, means there are multi-drug resistance that can take place. So antimicrobial drugs, the extensive use of these types of drugs can lead to drug resistance. The adverse effect of drugs can be seen. Then provided protection, it is generally temporary for a short span of time. Say there are some flus, so seasonal flu or swine flu vaccines were available, and they are recommended only, or they show their effect only for a particular span of say 3 or 4 months, winter days or like that. So chemoprophylaxis may be the basic preventive measure of many diseases like rheumatoid fever, meningococcal meningitis, cholera, plague, tuberculosis, even your rabies, so even TT. So these are chemoprophylactic agents or vaccines or the drugs which are administered and which show their effect for a very short span of time. Now there are international preventive measures, like international regulations may follow by different countries. So likewise, we know that the person who are traveling from infected countries, they are not allowed to move, or they're not allowed to land on that particular country. So thanks to this COVID-19, we can say we have learned many things of our curriculum, that how or what are the international preventive measures, what are the quarantineable diseases. Suppose a person is traveling from infected countries, so wherein there is an the country is identified as an epidemic, they are responsible for causing a particular type of diseases, so that type of measures can be taken up by that countries. Then quarantine measures taken for a certain animal coming from an endemic or infected areas, like the monkeys, cattle, rift valley rivers, fevers and all. Then imported goods, say raw wool, shaving brushes, so they have to be authorized, certification should be uh, followed, or that certification must be checked for. Then means of transportation, derating the certificate for ships in plague and disinfection of the planes coming from this endemic areas. The secondary preventions, there can be early diagnosis and prompt treatment, control measures to be taken for existing infectious diseases with following care objectives, that is case findings, detection and diagnosis of that cases, management of that cases, preventing further complications and sequels of that diseases, measures for contact and protecting susceptible persons, that is comorbid, they have been identified and they have been protected, preventing or minimizing the spread of diseases in involved community or group of peoples. Now, control of human behavior, a control of cases, there can be case findings, notifications. So that is, we can consider the COVID-19 in front of us, and we can read all these things. That is, cases of definite or suggestive diagnosis must be notified to a local health officer. The value of the notification to take preventive and control measures. Suppose there is increase in number of cases, immediately more restrictions should be immediate effect should be implemented. To help tracing the sources, that is contact tracings must be carried out. Collecting significant statistical data, so all this data has been pulled together and been given for statistics, and based upon that statistics, the government come up with, or the agencies, they come up with an findings. Next is isolating the cases of infectious disease must be isolated either at home, hospital or special places according to the nature of disease they cause. To stop activity and movement of cases in the community, to protect the case from risk of secondary infection, disinfections using that sanitizer and all. Concurrent disinfections is carried out during the course of disease. Concurrent disinfections means immediately after say 3 or 4 hours of that disinfections, another round of disinfection must be carried out. Say before entering and leaving that place, this disinfection should be done. Terminal disinfection at the end of the task. Treatment, many communicable diseases can be treated by using effective drugs. The objective of treatment is to kill that infectious agents. Then release, the patient discharged for the formal ending of inpatient care. So that must be identified, there must be given proper guidelines for that. Now control of carrier, how to control that carrier. So there are measures for that. So that carrier can be controlled by isolating himself, or we can say quarantining himself for 15 to 20 days, like enlisting controlling measures for contacts. So the suppose you have been identified that one person has been found COVID-19 positive. So what the agencies does is they go back and go for the contact traces. The people who have come in contact with that individual infected person in last say 5 or 6 days, all of them have been listed out, and they have been given instruction that what care should be done. Suppose they are showing such types of symptoms, immediately after immediately avoiding any further delay, they must get themselves diagnosed, they must get themselves treated for this particular diseases. So enlisting, examining, not to be exposed to the isolated cases, lastly surveillance, segregation and isolations according to the disease. Surveillance is that is the contact are put under observations or supervisions for incubation period. Segregations, contacts are excluded from school or work, that is they have been asked to work from home. Then isolation, contacting or contacts of the following diseases are isolated, that is cholera in non-endemic areas, pneumonic plague or pneumonic anthraxes and other such cases. Even COVID-19 there are isolations. Immunization and chemoprophylaxis are given. Now control of animal reservoir, in that case eradication of animal reservoir if applicable. Say for example the stray dogs, they are responsible for causing rabies. So now they have been identified, they have been pest control, or that pets have been collected by the municipal corporations, and they have been quarantined or they have been dumped in different a particular area. Then community control measures, the epidemiological study and investigation to trace sources and channels of infections. Drastic control measures to be taken if necessary. Example, closing the schools and colleges and the mass gatherings and all. Surveillance is an ongoing system, that is systematic collection, analysis, interpretation and dissemination of health data. Eradication of infectious disease is getting rid of that causative agent and consequently of that disease. No report of cases means no reservoir of infection, we can say it is eradicated. Elimination of disease means that the disease is still existing but the number of cases are below the threshold. The tertiary preventive measures is the disability, limitation and rehabilitation. That is all these things we have learned in our couple of slides before. Their purpose is to reduce or eliminate the long-term impairment and disability, minimizing the sufferings, the other organ loss and all. Optimizing the functions, prevent the further deterioration of the cases, to help complicated cases to cope up with their handicapped condition. Next is the vaccination and immunization. Vaccination is the term used for getting a vaccine. This is actually given the injections, we all know this. There can be oral, it can be subcutaneous, it can be intramuscular and all. So US, that is CDC, Center for Disease Control, it defines vaccines a product that stimulates a person's immune system to produce immunity to a specific disease, thus protecting the individual from that disease. So vaccines are usually administered through needle, but can also be given through oral or through spray or through other modes. Now vaccines is the process of getting vaccination is the process of getting vaccine into the body, or the act of introducing a vaccine inside a body is called as an vaccination. So we all are familiar with this thing. Needless to talk on this. Immunization, we know all these things. There are guidelines given by WHO and all. So according to this WHO, immunization is a process whereby a person is made immune or resistant to a particular infectious disease or condition. Typically administered. So we have, and by birth we have some immunization schedule and that has been followed. And depending upon the country and depending upon the geographical location, that area, that culture, there are slight modifications in that recommendations or immunization chart. The people, they becomes immune to a disease when the body has been exposed to either through illness or vaccination or immunization. Means which type of vaccines we are taking, whether we are using a subunit vaccine, we are taking attenuated vaccine or recombinant vaccine or not. Now epidemiology of non-communicable disease, we will discuss this in next lecture.